Good morning, and thank you all for being here. My name is Brad Woodhouse. I'm the Executive Director of Protect Our Care. I want to thank Maggie Lazarder and our New Jersey team for all of their hard work in putting this event together. You see behind me, Care Force One. Care Force One is the bus that we're driving across the country to help bring to the American people lower costs and better health care. Now you may think, well, I've heard of the Affordable Care Act and Medicare and Medicaid. Why do we need more affordable care? Well, I can tell you why. And these gentlemen behind me and ladies and these advocates will also tell you why. We have a once-in-a-generation opportunity to improve health care for the American people. Not since the passage of the Affordable Care Act have we had an opportunity to do more, to improve care for the American people, to lower costs, expand coverage, and to lower prescription drug costs for the American people. Now, I'm going to date myself a little bit. And Congressman Pallone and former Congressman Becerra will remember, you will remember that you ran to capture the majority in the House of Representatives in 2006 on the 6 for 06. The third plank in the 6 for 06 that helped propel these gentlemen to the majority to put Speaker Pelosi in the Speaker's chair was lowering the cost of prescription drugs by giving Medicare the power to negotiate. It's kind of crazy. You talk to people who are like, you mean Medicare can't negotiate? No. Secretary Becerra can't negotiate. His Medicare director can't negotiate for lower drug prices. Medicare is the largest purchaser of drugs in the world, largest consumer, and can't negotiate for lower prices. So that's an historic opportunity. Extending the premium reductions that were part of the American Rescue Plan, President Biden's American Rescue Plan, doing that is an historic opportunity. Closing the Medicaid gap coverage. Now you might ask, well, what's the Medicaid gap coverage? Well, that's the dozen or so states that for sheer politics, Republican governors, Republican legislatures have refused to expand Medicaid under the Affordable Care Act. Or I'm sure their reason is they don't want to do it under Obamacare. Well, whatever it is, it's wrong. There's a cohort of Americans in those dozen or so states that need access to health care. And we know Medicaid expansion works. It helps the economy. It helps people go to work. It lowers incidences of disease. It's important in rural areas. It helps keep community hospitals open. And then finally, another generational opportunity is expand benefits under Medicare to provide seniors vision, dental, and hearing benefits. Now, Medicare is one of the best healthcare programs in the world and one of the best administered. The one set of benefits it doesn't have are critical to seniors, as critical in your quality of life at that age as many other healthcare concerns. That's vision, dental, and hearing. And where do we get this historic opportunity, this once-in-a-generation opportunity? In President Biden's Build Back Better reconciliation plan. Healthcare is one of the central tenets. Last week, those of us that are healthcare advocates, it was a great week for us. The Vice President gave a speech in Washington about the importance of all of these elements, plus the great work that Secretary and his team have done in the special enrollment period, signing up millions of Americans that need health care in the middle of a pandemic. Donald Trump refused to do that. Secretary Becerra and Joe Biden said, we're going to have a special enrollment period. So we had the Vice President. Then we had the President. The last speech before he left town was about the importance of getting prescription drug costs down. And this is a win-win. Look, if we pass legislation to allow Medicare to negotiate for lower drug prices, we save $500 billion for taxpayers. And that money can be plowed into all those other provisions, expanding Medicare benefits, ending the coverage gap under Medicaid, and extending premium reductions under the Affordable Care Act, which will not only reduce costs for millions of people, but will provide coverage for millions more. This is a one-in-a-generation opportunity. Now, it has to be part of reconciliation because guess what? The same Republicans that were coming for the Affordable Care Act, that tried to repeal it when Donald Trump was president, that tried to get it thrown out at the Supreme Court, a case we won in a defense that Secretary Becerra led when he was Attorney General of California. Those same Republicans, they haven't learned. They lost elections in 2017, in 2018, in 2019, and in 2020. They lost the House, the Senate, and the White House largely on the issue of health care, and then also in 2020 and how they addressed the pandemic. And now they're opposing all these provisions again. So Democrats are going to have to go it alone in the Build Back Better reconciliation bill. But that's why we're here. We're going across the country, 8,000 miles, 19 states, 36 stops to bring this case to the American people. We have a once-in-a-generation opportunity to lower costs, improve care, and the man leading that charge for this administration is the 25th Secretary of Health and Human Services. He is also a healthcare champion going way back in Congress as Attorney General of California. He is the Secretary of Health and Human Services because Joe Biden saw him as a person who could help end this pandemic and bring affordable coverage and affordable drugs to the American people. And by God, under his leadership and the leadership of Chairman Pallone and Democrats in Congress and President Biden, we're going to do it. And now it's my pleasure to introduce to you Secretary of Health and Human Services, Xavier Becerra. Secretary.
Brad, I hope the big kahuna upstairs was listening to your remarks, because I'm hoping that what you just said becomes reality, and I believe there are tens of millions of Americans who are hoping that what you just said becomes reality. And so thank you for the work that you are doing. I am looking forward to seeing you all continue the great work so we can have better coverage, lower costs for every American in this country. I know that's President Biden's fervent desire, and he is putting all his muscle behind that effort to make that happen. And so it is great to be here in the phenomenal state of New Jersey, recognizing that you were among the first to make it possible for us to move forward. Congressman Pallone has been a champion of some of these issues for the longest time. I am thrilled to be here with Congressman Pallone, the chairman of the Energy and Commerce Committee in the House, who has been a champion all the way back to the days when he was fighting for children's health with the CHIP program, and one of the biggest advocates of the Affordable Care Act back in 2009 and 2010. Certainly one of the biggest champions when it came to no surprise billing, to make sure that when we went to the hospital, we would not be jerked and feel shocked to see the price of our hospital stay that we never expected. You can thank Frank Pallone for the work that he did as a member of Congress to make that a reality. We are now in the process of implementing the No Surprises Act at the Health and Human Services Department. I also want to say thank you to Assemblymember John McKeon for his work as the chair of the Insurance Committee within the state legislature here, and certainly to Brad Woodhouse, who has been going all over the place for the longest time. We were in the same foxhole when I was the Attorney General, same foxhole when I was a member of Congress, and it looks like we're still engaged in the same effort to try to help Americans now on the whole effort to push through Congressman Pallone's work to make sure that all of us can see better drug prices. And that's why really we're here, because we think there's a story to tell, and we're not going to tell it as well as would Maura and Laura and Lisa Ann, who are about to speak after me, but I know that the story is there. You know it well too. It's about having the peace of mind when you come home after you've taken your child to the hospital, knowing that you can still pay the mortgage even after your child has come back from the hospital, knowing that you're not going to have to give up the opportunity to go to college because you had to use medical facilities in your neighborhood to stay alive. It's not just the peace of mind, but it's knowing that if you're healthy, if Americans are healthy, our economy is healthy. And that's why this is always so very important. And so here we are with the President's Build Back Better agenda, because we understand that what that means is more health care, whether it's for the 2.5 million Americans who signed up during the special enrollment period under the President's request and now have that peace of mind, and in many cases are finding that they're paying somewhere around $10 a month or less in premiums as a result of having gone on to healthcare.gov, the Affordable Care Act's website, and found a quality, affordable plan that lets them survive the payments that have to come with it. It could be that the president's success in making the Affordable Care Act less expensive because of the health care tax cuts that millions of Americans got that made that health insurance more affordable becomes permanent because Congressman Pallone and his colleagues move forward and make that possible in the reconciliation package that they're working on. It could be that we now, for the first time, adding to the 55 years of success of Medicare, make sure that all seniors have access to dental services, hearing services, vision services, the way they should. And it could be that some 4 million Americans who today could have health insurance but don't have it because some 12 states in America have not expanded Medicaid coverage to them, even though they qualify for it. This reconciliation package would make that possible. For those 4 million Americans, that would add to the lower cost, better care for more Americans proposal under the Build Back America plan. And so it's time to get it done. It is time to act now. It is time to expand health access for all Americans. It is time to build back better now. It is time to tell every American in this country, you can have the peace of mind when you have to take your child to the hospital because President Biden fought to make sure you had better health care, lower cost, and like for everyone else, for every American. And so, Brad, thank you very much for what you do. Congressman Pallone, thank you for letting me visit your 6th congressional district. And thanks to all the advocates who've been making the push for all Americans to have access to great quality health care. Thanks very much.
Thank you, Mr. Secretary. You know, I want to, the history books, I think, will have to reflect the leadership that you provided in the defense of the Affordable Care Act. You know, I think a lot of people, when that lawsuit was filed in 2018, they were like, that's not going to go anywhere. Legal theory is crazy. Well, it went, and it went, and it went, and it hit the Supreme Court. But Secretary Becerra, then Attorney General Becerra, worked so hard to mount that defense. And it wasn't just the legal defense, which of course is the most important thing, but there's a public relations aspect to this. And he led the public relations charge about the consequences of the repeal of the Affordable Care Act. And I can't thank you enough for that. And the history books will reward you handsomely. The other thing I want to reflect on, and Secretary Becerra and I've had this conversation in other forums, is the pandemic blew open the racial disparity in health care that this country faces. And the Department of Health and Human Services has a host of ways, including with respect to data, that they can start to address that issue. But passing the Build Back Better reconciliation health care provisions, expanding Medicaid in the states that have refused to expand it, lowering drug prices, and making the Affordable Care Act more accessible and more affordable to Americans will go a long way in helping reduce those racial disparities. It's another reason that this is so important. So with that, I want to introduce someone who I've been dealing with for a few years now. Congressman Pallone here has been in Congress for a couple of years. And, you know, I think of him in kind of baseball parlance, like he was in the farm system, he was in the minors, he worked his way up to the majors. Now he's chair of one of the most powerful committees in all of Congress. And in baseball parlance, he's just hitting his prime. I mean, if you think about all of the jurisdiction that the Energy and Commerce Committee has, it is stunning the responsibility and the burden that is on Chairman Pallone's shoulders, and it expands well beyond healthcare. I can tell you, as a healthcare advocate and someone who runs this organization along with our colleagues, we sure as hell hope that he's the chair of the Energy and Commerce Committee for many, many, many years and terms to come, because his leadership has absolutely been critical. He's been champion for the Affordable Care Act. He has been a champion for lower prices and better care for all Americans. But I think most importantly, because it really is the tip of the spear in this healthcare effort in the reconciliation bill, he's been a champion for lowering drug prices, for giving Secretary Becerra and the Medicare and Medicaid administrator the authority to negotiate for lower drug prices. He introduced that bill along with Speaker Pelosi in 2019, and it passed the House. Of course, we had a Republican Senate and a Republican president, and it wasn't going anywhere. But he's introduced that bill again. It's known as H.R. 3, the Elijah Cummings Lower Drug Prices Now Act. It is the basis for what we need to do. It provides the savings for all these additional benefits. We would not be here today if not for the leadership of Frank Pallone, chairman of the powerful House Energy and Commerce Committee. Congressman Pallone.
Thank you, Brad. Thank you, Brad. I like that just hitting my prime, because when I pulled up here in this park, I told some of my staff who are much younger than me that when I used to clerk for a judge in New Brunswick after law school, that I used to jog around the perimeter of the park every morning, and nobody believed me. So, there was a day. In any case, I wanted to thank you and Protect Our Care and all the advocates that are up here today, because you've been so much involved in so many of these healthcare issues that help the average American for so long, particularly with regard to the Affordable Care Act, or some of us call it Obamacare as well. But I have to say the same thing about my friend Xavier Becerra. So proud that he is the Secretary of Health and Human Services. When I heard that he was being considered for the position, I was so happy, because he's the most qualified person they could possibly have in that position. I remember him mainly when he was on the Ways and Means Committee, which has a health subcommittee like Energy and Commerce. Sometimes the two committees are in competition, and we won't say how. But, he was very much involved in all these things. When we did the Affordable Care Act, when we did CHIP that he mentioned, so many things on the health care scene. And then, as Brad mentioned, as Attorney General in California, he was always out front, not only on the ACA, but so many issues. What I know, I don't want to keep talking about Xavier, but Xavier really cares about the little guy. And that's what this is about. That's why we're here today. If you look at his career in terms of what he did in Congress and what he did as AG, he was always looking out for the little guy. What I mean by that is the person who's middle class, doesn't have a lot of money, and as you said on this issue, Xavier, oftentimes has to choose between whether they're going to buy a prescription drug or pay the rent or even pay the food. And I think a lot of times we forget that, but he never did. And that's always been sort of the hallmark of what he did in whatever position he was in. But I really am glad that we're all here today, because the time to act is now, right? During the COVID period, for years we've seen the price of prescription drugs go up, even during the COVID period. So just to give you some statistics here right now. First of all, we know that Americans pay more for prescription drugs than people in any other country in the world. And I just don't think that's fair. You actually said that too, Xavier. What's fair? It's not fair. Why is, because we're not talking about the wealthy. Why is it that the average person in this country has to pay so much more than somebody does in Australia or Britain or Germany? It's just not fair. We estimate that Americans pay 3, 4, or even 10 times more for the exact same drug that people in other countries pay. So like if you go to Canada and you compare, you will see that as an example. And the drug companies continue to raise prices, even in the middle of the COVID-19 pandemic. In 2021 alone, Big Pharma has hiked the price of 1,100 drugs in the United States, 90% of which were above the rate of inflation. And what is it? This does what Xavier said. It forces people to make tough decisions about, whether they're going to take drugs and save their lives or pay for food and rent. And that's not the kind of choice that the average American should have to make. So we're here today basically to say, Brad, enough is enough. It's time we level the playing field. Now, the bill that I've been championing now for a number of years is called H.R. 3. It's named after Elijah Cummings, who was a congressman from Maryland that both Xavier and I knew well, who was a big advocate for lowering prescription drug prices. And it actually has passed the Congress twice. So if somebody comes up to you and says, this is novel, this is not novel. This has already passed the House. I should say the House twice, not the Senate. Passed the House twice. last Congress with bipartisan support with some Republicans. And what it does is it fully empowers the federal government, basically the Secretary of HHS, which is what Xavier is, to negotiate the cost of prescription drugs and make those prices available not only to seniors under Medicare, but to all Americans with private health insurance. So we're talking about not only Medicare, but also the commercial market. I want the media to understand that. In addition to negotiating prices, the bill caps Medicare Part D, which is your prescription drug benefit, out-of-pocket costs for seniors, so that they're actually capped, I think, at $2,000, which means that all their co-pays and everything can add up to more than that. The bill then uses, as Brad mentioned, the federal government savings from these lower prices to reinvest in a lot of other things. Now, we don't know exactly how. We're going to see when we proceed with the budget reconciliation bill, which things we'll pay for, but it does allow us to reinvest that money in a lot of things. Now, from a process point of view, the reason why we're saying the time is now is because, as you know, last week the Senate, or maybe it's 2 weeks now, the Senate passed a budget resolution. The House is going back next week to pass the resolution. And this sets the stage for what we call a budget reconciliation bill, which is $3.5 trillion basically in spending. Now here's where I'm going to digress a little bit. This is where the Energy and Commerce Committee versus Ways and Means. Guess what Energy and Commerce gets to do? We get to decide how to spend the money, John. Guess what Ways and Means does? They have to figure out how to raise the money to pay for it. Wouldn't you rather be on Energy and Commerce?
I'm with you, Congressman.
but in an effort to try to help with the pay for, we want to put H.R. 3 in our markup, if you will, for this reconciliation. And that saves, the Congressional Budget Office says that will save the federal government about $450 billion. So Ways and Means won't have to come up with any tax increases to pay for that, because it'll be paid for a lot of these reinvestments and things that Brad mentioned, like it could be used to expand Medicare benefits for hearing aid or vision, for example, or it can be used to either make the subsidies under the Affordable Care Act permanent or at least long term. So we're actually using this money from H.R. 3, from the negotiated prices bill, to reinvest in these other programs that will help the average American. So I don't want to say anything more than that, other than to say that the time is now and explain to you why there's a real opportunity to do this, so that when we're talking about this now, we're not talking about it just passing the House. We're talking about it passing the House. That reconciliation bill goes over to the Senate. They adopt it, hopefully quickly, and the President, as was mentioned by the previous speakers, has firmly come out in favor of doing this as part of this budget process. So thank you again for all that you do. And thank you, Xavier, for being here.
Thank you. Thank you, Chairman Pallone. Now I want to introduce someone who's very important on this issue right here in New Jersey, Assemblyman John McKeon. He is chair of the Financial Institutions and Insurance Committee. And you should know that the current governor of New Jersey ran on health care issues, won on health care issues, and then had to push back here. And you were part of that, had to push back on what Trump was doing on health care, and has done a lot to address coverage and cost right here in the state. He's a true partner with Congressman Pallone and others, and it's my pleasure to introduce Assemblyman John McKeon.
Thank you, Brad.
Thank you.
Brad, thank you very much. First off, I apologize for the beginning. I feel I was outside. I didn't have a mask on. And not that I didn't think I was safe, but I did become a new grandfather. My wife will have me in quarantine for 2 months. So please, any press out there that took pictures, block me out. That's it. You know, I thank you for bringing up things you did. First of all, Secretary Becerra, I whispered to you, I said, your parents must be awful proud of you for all the things that you've accomplished in your life and what you do. I'm impressed by much of it, but the pay for delay as it related to the pharmaceutical companies who literally were paying the generics to hold out of market, that work was just extraordinary. And Congressman Pallone, you know you've long been a hero of mine, going back to many, many years ago, sitting next to you when you're in the New Jersey Senate. What you're doing with H.R. 3 is amazing, and what you do for the environment, a little off of today's subject, is something that so many of us admire and is just so important. And to all of the advocates, I met some of the folks in Maura's group before, and they said, oh, we work for Maura and Collingsgrove. And I said, oh, so do I. So that's the influence that New Jersey Citizen Action has on some of our policies here. And let me take 2 minutes just to talk about those, because since Governor Murphy did come into office, we made great strides as we had to protect against the losses and the Trump's attack on the Affordable Care Act. So we took things relative to pre-existing conditions, to young adults remaining on their parents' policies, to no lifetime caps, and we made sure they were imbued in New Jersey law. And then we took resources from a policy tax that was supposed to be spent for the reasons that we're spending it and translated that to reinsurance. And as such, as opposed to our individual market and our small group market going up by 12%, it went down by 6%, and it's now robust. And so fighting against the Trump administration was something for the last 3.5 years, but now we can do even better. And our own secretary, our exchange market, we're in the open enrollment period now. It's doing really well in New Jersey, and we hope that we're a model for the many states that haven't, and while the Biden administration is going to make that the case for all Americans. You know, I just a couple things to mention without getting in statistics that we should be better than. We spend more than any other country without better medical outcomes. We can do better than that. You know, 18 years ago, a month's worth of insulin was $20. For the same product today, in a month, it's $275. We, can do better than that. If you can imagine this, Congressman, 43% of New Jerseyans, as it relates to prescription medications, they either ration or they just delay or defer. We can do better than that. And with the leadership from a federal perspective, with the commitment of Governor Murphy and the legislature, we will. We have a prescription drug affordability board that I'm pleased to be the prime sponsor with my good friend Troy Singleton from South Jersey in the Senate. And we all need to resolve to make certain that when we get into this November session, that we move to make that the law, that the PBMs that are just an unnecessary part of that group are looked to as to what they were supposed to be, something like third-party administrators, as opposed to the keeper of the discounts and you name it, relative to adding more than 40% to the cost of our prescription drugs. So together, we will do it. Failure is not an option. Again, thank you for making me and allowing me to be a part of this today. It truly is an honor, and we look forward to working with everybody collaboratively. Thank you.
Thank you, Assemblyman. All right, we're going to move quickly now because our principals out here have another event. So with that, I want to introduce, as you've already been introduced, as we know we all work for you, Maura Collins-Grew, Healthcare Program Director, New Jersey Citizen Action. Maura, come on.
Thank you, Brad, and thank you to everyone here. And I just want to say, we are happy to work with all the people here on this stage. The things that we have done under the Affordable Care Act would never have been possible without the blood, sweat, and tears of all the people you see standing here and the hundreds and thousands of advocates all across this nation. I want you to know there's a saying, all roads lead to New Jersey. Well, this bus and Secretary Becerra could not have skipped New Jersey, because not only do we have our champions of healthcare reform and lowering drug prices, this is also the state that delivered the majority that is going to make this happen. And my call to all of you today is this. You've heard the statistics. 1 in 5 New Jerseyans can't fill a prescription. But for Blacks and Latinos, that is 2 and 3 times that number. We cannot allow this to persist. We have to put patients above profits, and the time to do it is now. We need you, the public. We need those advocates who walked the streets across New Jersey to save the Affordable Care Act, to send your stories, to make your phone calls to Congress, to write your letters, and to stand with us as we make this a reality, because we cannot wait. Americans deserve better. We need fair drug prices now, and we must do better. Thank you. Come back again. We have lots here in New Jersey, and we are so pleased to be here with all of you today. Thank you so much.
All right. Thank you, Maura. And with that, I want to introduce somebody who's very near and dear to the hearts of those of us that protect our care. Laura Packard we are both co-chairs of Healthcare Voter. She has been, I think, on every Protect Our Care bus tour that we've had, real and virtual, and she was an advocate for saving the Affordable Care Act. She was based in Nevada during that fight. She, I think, single-handedly ran out Senator Dean Heller, who was a United States Senator who supported Trump's efforts to repeal the Affordable Care Act, and she has an emotionally gripping story about how important these issues are in her life that is reflective in the lives of millions of Americans. Laura?
Hello. 4 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. I'm still here. I'm still alive thanks to the Affordable Care Act. But our work is just beginning. We live right now in a time where we can make it better, where we can make the subsidies that were part of the American Rescue Plan permanent so that more Americans can afford the health care they need. We can strengthen Medicare so that it includes vision and dental and eye care. We can fill the Medicaid gap. So in states that are not as fortunate as New Jersey, where their leadership let them down and didn't expand health care to their low-income people, we can fix that. And we can lower the cost of prescription drugs to help pay for it. When I was going through my cancer treatment, part of that treatment was chemotherapy to take down my immune system, which was the problem. And it turns out that not having an immune system is a bad thing. So my doctor prescribed a drug for me to help bring my immune system back up faster. But this drug was $13,000. So I went without. And I wound up in the hospital for a week and nearly died. This particular drug was built on taxpayer research. We already paid for it. We are already paying for far too many drugs that Americans are priced out of today. But with our leadership here and in Washington, we have the opportunity now to do something about it and lower the cost of prescription drugs. Thank you.
Thank you, Laura. And last but not least, a story from right here in New Jersey and Princeton. Is that right? I want to introduce Lisa Ann Trainer. Lisa Ann?
Good morning. My name is Lisa Ann Trainer, and I'm a chronic illness writer and patient advocate. I live in Princeton, New Jersey with my husband, Stephen, and our 3 rescue dogs. When I was 16, I experienced a trauma that left me with severe fibromyalgia and PTSD. At 19 years old, I was officially diagnosed with both PTSD and ADHD, and I began taking prescription medication. One of the medications I was prescribed, Vyvanse, made a remarkable difference in my quality of life. Before finding Vyvanse, my symptoms were too debilitating to function normally. When I was taking it, I was well enough to take care of my home, engage in advocacy, and focus energy on improving my health. Unfortunately, this life-changing treatment came with a steep price tag of over $1,000 a month. For 2 years, I was able to afford it because of my husband's insurance, but I always lived in fear of what would happen if we were to lose coverage and have to pay the full price of the drug. Last summer, in the middle of this terrifying pandemic, my fear became a reality. Due to a change in my husband's employment, my family was left without insurance, and we were forced to pay for all of my prescriptions out of pocket. Because of Vyvanse's steep price, I had to make the difficult decision to stop taking the drug completely. There's no generic alternative, so I'm stuck taking a different and less effective medication. Instead of focusing on my health, I worry about how I'll cover the price of my next prescription. And as an active member of the chronic illness community, I know my story is not unique. I want to speak up for other patients. We need change. Patients like me need our elected officials in Congress to take meaningful action to lower drug prices now. We need Congress to allow Medicare to negotiate lower drug prices. There are solutions now in Congress, including H.R. 3, the bill Congressman Pallone champions in the House, that would be life-changing for patients like me. The Biden administration, including Secretary Becerra, have been clear about their support for Congress to pass Medicare negotiation legislation. Congress has the best chance to pass Medicare negotiation than it has had in years. I can finally envision a reality where I would no longer be prevented from taking the medication I need because of its inhibitive price. I am so grateful to Congressman Pallone and Secretary Becerra for fighting for legislation to allow Medicare to negotiate lower prices. I urge all of the New Jersey leaders in Congress to stand with their fellow Congressman Pallone to support Medicare negotiation and fight for the thousands of New Jerseyans like me affected by the unaffordable price of their prescription drugs. So many New Jerseyans are suffering right now. We don't have time to wait. Thank you.
Thank you, Lisa Ann. I think, Lisa Ann, your story, and Laura, your story is why we're all here. It's why this work is so important. Now, you've hit on something very important. And Congressman Pallone knows this, Secretary Becerra knows this. We have tight margins, 50-50 Senate, very tight margins in the House. We need every vote. We need every vote. We need every vote of every Democrat in New Jersey. We need every vote of every Democrat in every delegation across the country. So just sum up, and then we'll open it up for questions quickly before Secretary Becerra has to depart. I just want to thank everybody for being here. We are truly fighting for these issues. This is a generational opportunity. This is our Affordable Care Act opportunity, our passing Medicare and Medicaid opportunity, and it all comes together in these issues. And you piece it all together, it will affect the lives of millions and millions of Americans, bringing down the cost of prescription drugs, expanding Medicaid in the states that haven't done it, expanding benefits under Medicare, and lowering premiums and extending coverage to millions more as part of the Affordable Care Act. It should be done. It shouldn't be partisan. It shouldn't take reconciliation. But by God, if that's what it takes to get it done, we're going to get it done. And with that, I'll be happy to open up any questions from the press.
Secretary Becerra, New York City today is starting pay for requiring vaccines for indoor dining in restaurants. Do you think New Jersey and other states in the country need to follow that lead?
So I think under the president's leadership, this administration has been very clear, following the guidance that has been provided by the medical experts and the scientists at CDC, FDH, and NIH, and the whole team at HHS, that we have to take care of each other. We're wearing these masks for a reason. I suspect most people in this crowd are vaccinated, but we're still wearing our masks. We understand how important it is to take personal responsibility for not just caring for ourselves, but for everyone around us, certainly our loved ones. I gotta believe you care about your children who are under 12 who cannot yet get vaccinated, and so it's important. That's why the federal government has provided guidance that says to every state, this is the best thing you can do, and then we leave it to the state and local governments to make those decisions on what to do, on whether to mandate a particular activity or not. And we hope that as schools begin to reopen for fall attendance in person, that we are recognizing that we all have a personal responsibility to take care of our loved ones and to be keepers of the good health, not just of our people, but of our economy.
I have two questions for the Secretary. How would you respond to the pharmaceutical industry, which would say bills like this would slow down innovation?
I would put Lisa Ann and Laura and Maura in front of them and say, listen to their story, and then have America listen to the stories of the industry versus the Americans who have to live with the prices of the industry. It is untenable. Life-saving drugs should not drain your life savings. And so it is time for us to act. As Brad mentioned, Congressman Pallone and I have been fighting to do something about high drug prices for forever. As my kids would say, for the history of ever. And it is time for us to act. And I agree with everyone who said that this is the time to act, because it is untenable for Americans to pay so much for medicines that most other places in the world they're paying far less. It is not right for any American to be gouged for any product or any service, certainly not when the industry could lower the prices and make them affordable, and certainly not when you're talking about life-saving medicines. It's one thing to gouge on some widget. It's another thing to gouge, as you heard some of our consumers testify, directly on things that they need to keep them alive or to keep them healthy.
I'm going to have to add to that, though, because first of all, it's not true. Oh, sorry. First of all, it's not true that, I mean, they're making money hand over fist, as we know, the drug companies, big pharma. And you should understand that, I didn't mention it, but part of the money from H.R. 3, part of the savings will be used to reinvest in research for new drugs. That's actually part of the bill as well. That'll be in the reconciliation. Look, you could walk to the corporate headquarters from this park of some of the largest pharmaceutical companies in the world, right? I don't have to name them, but you know where they are, right? You can almost see them from here, but for the trees, right? And I represent many of them, and in Middlesex County, and I represent the people that work there. If I felt for 1 minute that this was going to, negatively impact them in terms of their ability to invest in the drugs, I wouldn't be here supporting this legislation today. The fact of the money is they're making a lot of money. It's not going to inhibit their investments at all in creating new drugs. And in fact, we're taking some of the money to help them create new drugs. So it's just a false premise, whoever's telling you that. And I don't mean to get mad. I'm not mad at you, but
I think we have time for one more question.
Left unsaid, maybe you just touched on it. Why did you come to New Brunswick this semester?
And I'm going to have Congressman Pallone join me on this one. But we've seen a lot of change in the state of New Jersey, as we've seen throughout America. New Jersey is home to the very first vaccine administered as a result of COVID. And so New Jersey has done a lot of firsts. New Jersey has proven innovative. New Jersey has proven that it will take on a tough fight. And New Jersey happens to give America some of its best fighters. And so I think this is a great place to come to tell people in America that we are ready to act now to make change, because whether it's your own health or whether it's your own decades of fighting, we must do this to keep America healthy. Congressman, you want to?
I think he said it all.
Great. Thank you, and I think that really summed up why we're here. This is an opportunity to make America healthy. I can tell you why we're here. We believe that every state, every vote counts in this fight. We have just 6 weeks, 8 weeks, 10 weeks, however long, how quickly you can do this, Congressman. But we're in this fight. I want to thank the Secretary for being here. You know, Secretary, we could use you somewhere else on this tour, so we'll get the schedule over to your people. But thank you all for being here. Thank you, Maura. Thank you, Assemblyman. Thank you, Lisa Ann. Thank you, Laura, and thank all of you watching out there across the country. We are going to have better care and lower costs because of the work of these people. Thank you all.